All right. You want the microphone?
Yeah.
Here you go.
Thanks everybody for coming, and this is being recorded, and so you can watch it again and again. Selena will be back in November to do it again. She said that this is perishable information, and I said it's also so you don't perish. So this is important. Selena was born and raised, well, I don't know about born, but raised in Pescadero, made sandwiches at Robert's store, and then was recruited to the fire department and has worked there forever since. She's a public education officer and emergency preparedness coordinator for the Woodside Protection District. And we know how often you all are here. We think most of your adult life is spent here. And I happen to know several people who would willingly have a heart attack so that you would come and take care of them. At any rate, she's worked there for 20 years, fire, life safety, so forth and so on. She's also vice president of the Emergency Preparedness Communities. That's a local nonprofit that partners with the fire district to have education for around town and so forth. Outside of work, she likes to travel. She's going to be on her way fairly soon to London and Prague. So if you have some travel tips, she'd appreciate that. And then Christmas in Scotland, which sounds like a good idea. This is really going to interest several people here. She has 3 cats and 1 husband, but the 3 cats part are 2 hairless Sphinx cats. So you're in cat heaven here, so that's nice. She's been a dancer for most of her life, and importantly, volunteers at the Elisa Ann Roosh Burn Foundation, which helps people who have been burned rehabilitate and get care at camp. So with that, well, we're very glad to have you and all of you here, and Fabian and others who would like to climb on the fire engine. There you are, Cal. They both are. They're the ones. This is possible for everybody who's always wanted to climb on a fire truck. Today's your day.
You ask and you shall receive here. I was going to say good morning, but apparently it's good afternoon, right? I do want to introduce Engine 8 is here to help me as well. We have Sean over there, the captain. We have Josh, we have Derek, and we have one of our newest recruits, Mitch, who I just met today. Yeah. Oh. All right. Okay, so before we begin, I really want to talk about what this is about and what it's not about, right? Today is about awareness. We're not training you to become medical professionals. We absolutely just want you to perform these 3 things, which we'll be going over excessively today. I want you to keep in mind that your facility already has medical personnel that are trained in CPR and advanced life care as well. I've been notified that the security staff here is also trained in CPR. So be aware of that. Get to know the extra staff that are working throughout here. Your role is simple. It's to stay safe, to notice what's happening around you, and to call for help. We call that a complete and meaningful response. So everything we covered today will be building on those 3 things. This is a question I get very often, especially when I'm teaching CPR and we're going through all the skills, and they just say, well, what if I panic? What do I do then? First of all, it is completely normal to panic, especially in emergency situations. Feeling nervous is not a flaw. It's basically your brain and your body doing exactly what it's built to do. So don't worry so much about that. Also, too, dispatchers are trained to handle panicked callers. So you don't necessarily have to make sure you sound completely calm, although we like to say be like a duck on water, right? So what's a duck look like on water? They're cruising along, right? Cool, calm, and collected. And then as soon as you look underwater, what are their feet doing? They're running like this, right? So panic as much, try to keep it on the inside, but just know that dispatchers are trained to handle panicked callers. So you will not be the first person. If you do have to call 911 and you do panic, you won't be the first person that panics to them. Also, perfection is not expected today, not by 911, not by the people you're trying to help, and absolutely not by us first responders. I want you to keep this in mind. You are the help until help arrives. So in emergency situations, we have what's known as the bystander effect. Has anybody heard of that? Raise your hand if you've heard of it. What it means is groups often wait because each person thinks that somebody else is already doing something, right? When in reality, everybody's just waiting around for somebody to act. So the person who moves first changes that outcome, even imperfectly, which is okay. The moment that you call 911, help is already moving towards you. So that happens the instant the call connects. So just getting 911 on the line is enough. Again, you don't need medical training. You need three things. You need your presence, you need your voice, and you need your phone. Your presence means that you want to stay with someone who may be in distress, right? That really matters to them. You're able to provide comfort to them, to let them know that they're not alone. It reduces their panic and keeps you able to report when things change, right? You're constantly assessing what's going on. You're gathering that information to share it with first responders and 911 dispatchers. Second, you need your voice. So calling out someone, call 911, breaks the bystander freeze. Pointing at a specific person is really good too. You is this pink? This beautiful color you're wearing, or you in the blue shirt, go call 911, right? So don't just say someone call 911. Make eye contact with that person and point to them. You go call 911. You go get an AED and come back, right? That's essential. They can grab the AED, but it's not going to do you any good if they don't come back to you.
What's an AED?
Oh, very good question. So an AED is an automatic external defibrillator. Yeah, so you may have seen boxes hanging on the walls around here that say AED, only personnel trained in use of AED to use this. We have them actually on the table over here. These are trainers. We're going to go through and show you how they work today so that you're able to use it yourself. They're very simple. They make them very simple, which is why they're everywhere now. You see them everywhere. Also, your phone. The dispatcher does all the medical thinking for you. Your job is to describe what you see and to follow their instructions. That's it. Once you get them on the phone, you don't have to worry about anything else, just following exactly what they tell you. So 3 things you can always do. This is the anchor side. This is what I want you to take home today. This is, if you forget everything else I tell you today, these are the 3 things that I want you to remember. Stay safe, assess, and call 911. So pause before you move. Look around. Situational awareness is really important. You want to look to see if there are any hazards, downed power lines, oncoming traffic, right? There could be many things that are happening. So instead of rushing, take a moment to look around and make sure that you're safe. So let's do an example. There's a person lying on the ground in the parking lot, right? And you see them over there. Instead of rushing to them, you want to make sure that there's no cars driving around. There's no cars that are moving around you, right? There's nothing that could potentially make a victim out of you as well. So make sure that that the situation is safe for you to help. If you're not sure it's safe, stay back and call 911. You don't have to do anything. You don't want to risk yourself, but you can still get help on the way there. So just stay back and call 911. When we assess, you don't need to diagnose anybody. Your job is not to determine what exactly is going on with the person. Your job is to describe what is going on with the person. Are they talking? Are they breathing normally? Also, too, what else do you see? What does their skin tone look like? Do they look pale? Do they look flushed? Are they sweating? Are they conscious? If they're conscious, do they make sense when they're talking? Are they unconscious? Are they still breathing? All of these things is important information which you can relay to the 911 dispatchers and the first responders when they arrive. Also, we want you to do this early. So we don't want you to wait until you're sure that it's an emergency, right? We want you to just go ahead and call 911. We'd much rather show up and it not be an emergency than you waited too long and then we show up and there's only so much that we can do. So when in doubt, go ahead and call 911. Am I correct on that? 100% right there. Also, we want you to stay on the line with the dispatcher. So they're going to tell you, they're going to give you all the information you need, what to do. They're also going to tell you to stay on the line with them. This also is helpful because they can help calm you down when they're talking to you. They give you tasks to do, so you're not just sitting there looking at what's happening. So stay on the line with them until they tell you to hang up the phone. At that point, then it's okay. But keep that line open. There are many ways that you can help without having to jump in and perform CPR or to get physical in any other manner. There are a lot of things you can do. First of all, again, and I'm going to be addressing these points over and over. So first of all, call 911. Don't assume somebody else did. Ask out loud, has anybody called 911? Right? If you're looking around and people are standing there, especially out in the rest of the world here, when something happens and somebody's on the ground or something's hurt, what are people doing when they're standing around? What do they usually have out in their hand? That's right. So if you see someone and they have their phone, you say, you call 911, right? Tell them to call 911. They already have their phone on them and out. Give them a task to do rather than them turning on their camera and trying to record what's happening. Give them an actual role. Also, we want you to unlock the doors for first responders. They can lose time when they can't get in. Propping that entrance open, buzzing them in, or flagging someone to meet them at the door is a real contribution. We want you to bring the AED if possible. You don't have to operate it, even though today we're going to go over how to operate the AED, but you don't have to operate it. Just get it to the scene fast. If someone is closer, call out, can someone get the AED from whatever location it's at? Does anybody know where the closest AED is here? Yeah, if you walked in that front door, you walked right by an AED. I would like to say that some of maybe your homework could be to walk around the facility and identify where all the AEDs are. I like to, when I go out and eat at restaurants, I always like to identify, first of all, where the exits are. And I always like to have, my eyes on an exit or my back at an exit. And I always like to know where the fire extinguishers are. That's just something I've been doing since I started working here. So I think a good thing for everyone here is to walk around and to identify those locations of those AEDs, because you may be in another area and you may have to send somebody to go get the AED rather than say, go get an AED. You can say, go get the AED that is located right outside Hanson Hall, right? Give them specific directions, because when we're panicked, we are not thinking clearly. And if you already have it ingrained in your brain, it's automatic. Also, guiding the responders once they get here is extremely important. Meeting them at the building entrance, saying, follow me, because it may not be Engine 8 that comes. They may be out training or on another call. Potentially, we could have a fire engine coming from out of the area that's not familiar with our district as much, coming to respond to this call. So it's important that you do everything you can to minimize the amount of time it takes for them to get to the patient. Again, directing bystanders works better with assignments. So you go call 911, you go get an AED. Also, if a patient has visible medical, like a medical bracelet, or sometimes it's a necklace or a tag that they have, that's really good information to have. If they have a bag of medications that's nearby, when you're looking around, that's really helpful for first responders as well. More information, the better. Try to gather as much as you can for us. Okay, so when we call 911, we want to do it, first of all, obviously, if they're unresponsive, right? Whether or not they are breathing, so they may be unconscious and breathing, right? Or they may be unconscious and not breathing. Either way, it's an emergency. There's something going on. So you could walk up to them, try to get their attention, right? You can tap them on the shoulder, say their name, or are you okay? Are you okay? Try to wake them up. If they're unresponsive, call 911. Something's going on there. If they have trouble breathing, so if their breathing just sounds wrong, if it's slowed, if it's labored, if they're gasping, or if it's absent completely, this is an emergency. Also, if they have chest pain, especially if they're sweating, if they have arm pain, if they have jaw pain, don't wait to see if it passes. Especially if they're, I'm okay, right? Just usually get that, I'm fine. Call for help. Again, we'd much rather come and find out that it's not a big deal than we waited too long to get them help. If they become suddenly confused, if they're disoriented, if they have slurred speech, or inability to complete sentences, this may be a signal of a stroke. So time really matters. And when I'm describing all of these things, again, you're not diagnosing what's happening with them. You're just noticing that something's wrong and they need help. So you don't have to remember, okay, I know these are the signs for stroke and this is a sign for a heart attack. You just need to go, okay, this is not normal. Let's get help on the way. If they're suddenly confused, I already said that. Yes, sorry. If they're seriously injured, so if you see them and there's obvious injured, maybe bone deformity, if they tripped and fell, or they're bleeding from a certain area, obviously it's time to call 911. And choking. We're going to cover what to do with choking, right, in more detail. This is just an overview. But if someone can't speak, cough, or cry, that's an emergency. If you're asking yourself whether it's serious enough to call 911, it's time to call 911. All right, so raise your hand if you've ever had to call 911. Okay, yeah. I've had to call 911 several times too. It was a little discouraging when I got a busy signal. So yeah, it happens. So what are the things that they ask when they call 911? Well, first of all, they want to know where your location is, right? So we're at the Sequoias, we're in Hanson Hall, or we're in building whatever, right? Be very specific about the details that you have. Know the address for the Sequoias if possible. The address is the best thing for it. But if you only can say what the nearest landmark is, because this is applicable not just for when you're here, but when you're off campus too, right? We're thinking of just in general, right? Landmarks are really good to use as well. Just know where you are in general. But here at the Sequoias, because this is such a large area, there are many buildings, make sure you provide as much information as possible. Then explain exactly what you see and say it in simple language. You don't have to use any major big medical terms. Just say a woman is unconscious and not breathing normally. Right, that's pretty basic. Or you could say a man's collapsed. He's conscious, but he's not making any sense. Those details matter. You want to say how many people. So you say one person's affected, I'm alone with them, or you could say one person is affected or one person is unconscious, there are many bystanders around. Those details are good too. And again, stay on the line. The dispatcher stays with you the entire time. They will walk you through it step by step. Okay, so falls. Immediately, your instinct is going to be to help these people, right? But it's essential to take into account some situations such as, first of all, falls are one of the most common serious injuries for older adults, and a hip fracture may not be visible. A person with a fractured hip may still try to stand up. So moving someone who has fallen can displace a fracture. It could cause internal bleeding or injure the spine, even if they look okay and want to get up. Their adrenaline's going. They may feel like, okay, I can get up, I'm fine. But you got to make sure they take a moment. Don't rush them. The fall itself is disorienting. They may be confused, embarrassed, or in shock. Rushing them physically or emotionally increases their distress and is a higher risk for a second fall. Also, call for help at that point. Call for help within the facility. Contact medical or security staff immediately. If you're unsure, again, or the person appears seriously injured, call 911. Then keep them calm. Stay with them. Speak quietly. Help is coming. You're not alone. If they want to try to get up, you can say, let's just wait till someone trained to help you can come and help us. Let's just make sure you're okay, right? Don't encourage them to get up right away. It's okay. Just take a moment. We're fine right here. Let's just wait. One of the most common things we see is someone trying to help a person because they're being kind. Right? I'm just trying to help them. But the problem is that sometimes kindness can accidentally make an injury worse. The best thing you can do in that moment is to stay calm, stay with them, and wait for first responders to show up. Also, signs of possible head injury can include confusion, vomiting, unequal pupils, right? You may see one that's bigger than the other. Signs of a possible hip fracture. One leg may appear shorter, may be rotated outward, right? These are all things you may see or you may not see. Do not move them if there is a chance of head, neck, or spine injury. Always, err on the side of caution in these instances. Help is nearby here. We're fortunate enough that we have trained medical staff as well as security staff that's trained. Do I have questions so far? Pretty straightforward, right? Right. Yes. Okay. Let me come over there. Oh, I think there's a. Should go back to this.
You keep saying call 911.
Yeah.
But then as sort of a throwaway, you mentioned that one time you called and the line was busy.
Yeah.
There seems to have been, or there may have been a situation for a resident here where 911 didn't answer and didn't respond. So what do you do if the 911 is busy or after 1,000 rings?
That's so
doesn't
true.
Pick up?
Yeah. So the biggest thing I can tell you, which actually I was listening to a program on NPR and they were talking about the 911 system and how many areas within the country don't hit their mark for response times, right? We're fortunate here where we do really well. But I live in San Jose, in Santa Clara County, and there was a time when it was busy. And what I found out when I was listening to this program is that whatever you do, don't hang up the phone because it resets that queue. And they will eventually, sometimes they will call back, but you're way down in the queue. So just keep that phone on. And if it's busy, when it was busy, I did hang up the line and I tried again and I got through. But San Mateo County is much different than Santa Clara County is. And I apologize if that startled people, but it was something that I really dealt with. But the main thing we don't want you to do is hang up. So just stay on the line with 911. Yeah.
What should we do if the fallen or injured person asks for water?
I would say no. Do not give them any water, nothing. Don't do anything until help is there. Let them determine what's going on and give them water if they're able to do so at that time. Is that correct?
Yeah, Angela. So basically,
Here you go. Mic them up.
I usually don't need a microphone.
Me either.
So the reason we don't want you to give water at all is because it can delay surgery. And so what happens is we have people who want to help. They want to give a little bit of water to somebody. But then when we get down to Stanford Hospital, they have their own checklist for surgical needs. And then one of the first things in there they had food or water recently. And it doesn't mean that they can't have surgery, but it could delay things or something like that. So what we always try to tell people is don't give them a glass of water. If they need water because they're dehydrated or had anything to do with their injury, we're going to give it to them via an IV, right? We'll put a needle in their arm and we'll administer water that way. So I know it's hard sometimes, and we break that rule every so often where we'll give a slight sip of water. But if you notice, we don't even give anyone a full glass of water because of our experience. We've had this happen to multiple patients, unfortunately, and we don't want to delay surgery if it's a call that needs that.
That's a great point too. Is like sometimes you want to do something that's comforting to them. And so you're like, here's a glass of water, right? To help them calm down. So no on that. Thank you. Any other questions so far? Okay. Got one in the back.
When I saw somebody here at Sequoias who fell down, I saw her fall just straight over backwards. Mm-hmm. And I went up to her and said, "Is your hand okay?" And she said, "Yes." And so I said, "I'm going to hold your hand until help comes." But the staff was telling me, "Don't touch her, don't touch her." And I'm wondering, when somebody is stressed like that after an accident, does it help to just hold their hand until help arrives, as long as you check to make sure that they don't have an injury there?
Yeah, that's really why they're telling you not to touch them, is they don't want you to cause further injury. But sometimes even just placing your hand on their shoulder, right? Or to provide comfort with them someplace so that they feel that you're there. But they're telling you that because they don't know what's going on. And especially if there's a potential for a spine injury, right? Neck injury, spine, all that. They want you to just leave them as they are, which also means too that you want to make sure they don't move around, which can be difficult because they might want to just get up immediately. I'm fine. You need to make sure that they stay where they're at, that they're not moving. Great. All right, choking. So we have a universal sign if somebody is choking. It's just a natural thing we tend to do. Does everybody know what that is, right? Yeah. Right? They grab their throat. Yeah, it's the universal sign for choking. So you'll know if somebody is choking, if they're grabbing at their throat. Now, you can ask them, can you speak? Can you cough? If they're making sounds, right? They're coughing. They may be, but if they're coughing, encourage them to continue to cough. You don't want to give them the Heimlich or back slaps, which is what we do now first, to somebody who can still cough. Their natural, the natural mechanism for the coughing is actually very, very, it's good. It's what will work best. But if there's a point where they stop making sounds, right, where they start changing color, you'll see their skin start to go from pink to, bluer and gray. They start grabbing at you excessively, right, because they're panicking. Then at those times, those are signs to perform the Heimlich maneuver, or back slaps is when we're start. And also too, at that point, if there are other people around, have somebody call 911, because even though you may be performing back slaps, it may not help. So they may go unconscious and they may go down on the ground. They may CPR at that point. So just get help on the way. Especially you have people here, you guys all had a wonderful lunch. And, it's a very social lunch. And that's the most common time when adults start choking, is when we're hanging out with each other and we're eating, we're not paying attention, and we just put a big piece of food in our mouth. We don't chew it completely and we start choking. And what can be common with adults too is we tend to get embarrassed. And we've had incidents where adults would start choking and they get up and they quietly go into the bathroom. Well, if nobody is in there and they go unconscious, yeah, they could potentially die. Yeah. So be aware. If you see someone and you're like, oh, that doesn't look right, what are they doing? I always tell people, go in after them or send somebody to go in after them to check on them, make sure they're okay. Also, we always say ask permission, right? Well, if they really are truly choking, they're not going to be able to tell you, yes, you may help me, right? But you can just go up to them and say, I'm trained, I'm going to help you. They'll probably usually nod their head or they'll be so frantic, right? But it's just notifying, telling them exactly what you're doing beforehand. And again, we're going to get into the hands-on choking here soon. Okay, this is a really important slide to keep in mind. This is all completely normal. When you're shaking, it's adrenaline, it's totally natural. The stress response, your hands may shake while you dial the phone. The call still goes through, right? You still have a 911 on the line. It doesn't matter if you're shaking or not. It's just adrenaline. You could forget things. The stress response narrows focus. So things you learned today may not surface instantly. That's why we're here to keep returning to just 3 things, which, do we remember the 3 things? Stay safe. Assess, right? And then call 911. That's right. Just those 3 things. Also, it's totally normal to feel emotional, crying, feeling scared, feeling overwhelmed afterwards. This is not weakness. First responders debrief after calls exactly for this reason. It's completely normal. Also, freezing. Most people do briefly. It's the brain assessing, right? It's trying to figure out what's going on. How do I respond? A brain freeze is completely normal. The goal is not to eliminate it. It's to have something simple enough to reach for when the freeze breaks, right? So you're sitting there going, and then you're like, okay, I need to figure out, look around, right? And then if you need to call 911, call 911 at that point. Give yourself a moment. Also, speaking too loudly or softly, that's completely normal too. The dispatcher will manage. They've been trained on how to deal with panicked callers. Not remembering details, normal. Don't expect perfect recall. All of this does not mean that you failed, as you're still doing something. And all of these things are normal. Oh, wow, right into this. Try to keep it light. Do we have questions before we get into the hands-on? Yes, here.
I went through a resident fall on Saturday. Outside of coming out of the dining room, 4 of us were coming out of the dining room, coming up the ramp from the dining room, and one of the residents fell down and hit his head so hard, I'll never forget the sound. I turned around and he was lying right below me, completely unconscious. He didn't look like he was breathing and blood was pouring out. So he was lying in a pool of blood. Now, what I want to underscore is the importance of calling 911. And the problem with that is none of us had a phone. These buttons don't call anybody. They don't even tell the nurses where you are. I was under the impression that these were GPS and would tell the people where you are. They were at the residential facility that I was at before. They do not. So by the time the nurse got there, and I don't mean this to be critical of anybody or anything, the fire department was already there. The ambulance was already there. So one of the lessons that we learned was carry your phone. These are not emergency panic buttons. All right. Now, maybe they're working on that, but right now all it does is tell them where your unit is. So if you're not in your unit, all the nurse does is go to your unit. So I'm going to say this a million times. Start carrying your phone. Now, one of the people with us had the presence of mind to run in because she had seen a security officer at the front desk. The security officer came out, but he didn't stand close enough to see what was going on. So we were relaying the information. And I told the security officer, this is a life-threatening emergency. He was not breathing. He was unconscious and blood was pouring out of him. So finally, the fire department showed up and they were unbelievable. But the importance, I can't say this too much. We did not have a phone. I thought this was going to bring people right away. It does not. So start carrying your phone and call 911. Fortunately, I understand he's coming home from the hospital today. But anyway, that's what I have to add.
And actually, I think our captain over here was on duty for that incident. So good job. Yep. Yeah. Yeah, that's really important. Oh,
I'd be dead was my weight.
I would like to mention from personal experience the importance of time with respect to a stroke. 3 years ago, I had a stroke. I recognized I felt strange. My daughter had just arrived from Washington State for a visit, so she was there. And I said, Laura, I feel odd. Then I realized I couldn't move my right arm and my right leg, and I knew immediately I was having a stroke. I said, Laura, call the front desk and call 911. And due to being fast, I've regained 90% of movement on my right side. A friend of mine who had a stroke 8 or 10 years ago, and 911 was not called, is paralyzed on the right side. So please understand the importance of time. If you are talking to a person, their speech becomes garbled. If they feel paralysis anywhere, or you see the side of the face start to drop, the classic thing, ask a person to smile. And if they don't naturally have a crooked smile, that also is a sign of stroke. Call 911 immediately. I got to the ER. They did not even check me in. They put me right into a CAT scan and said, will you sign the form for the clot buster? Clot. A stroke is caused by a clot. And I signed it. I was given clot buster, and almost immediately the paralysis started to abate. Within 5 hours, it was gone. So I just have to stress the importance of speed. If there is any inkling a person might be having a stroke, and I speak from personal experience. Thank you.
yeah, I'm glad to hear you're doing well. Yes, time is of the essence. Again, we want to make sure that we're not going to become a victim as well. So, quickly look around, make sure there's nothing that you missed, but absolutely, you could still call 911 before you go in and see what's happening. If you notice somebody's on the ground, it doesn't look normal, you can get 911 started right away. So what we're going to do is we're going to break off into 3 groups, or and just so that you guys can see better, right? I have a station over here, I have a station over here, and one over here. And we're going to review first. Let's see what's on here. We're going to do choking first. And I actually have one of my all-star instructors here, Josh, who's going to just go through what we do first of all, and then we'll kind of go around and see if you guys can at least have the proper hand placement if you do have to help somebody who is choking. It's so weird to talk with a microphone. I'm so loud normally, so I have to kind of lower my voice. Good luck.
Yeah, I recently lost my voice, so bear with me. Choking, obviously, we're looking for those universal signs. Sorry, my voice is a little raspy. So what we're going to go through, obviously, these steps, 1, 2, and 3, 5 back slaps, 5 abdominal thrusts, and alternate and repeat, right? And so if I can get Derek to come up, please. It's kind of hard to do with the microphone.
Your narrate.
Yeah, I'll narrate it for you. So back slaps are going to be for when we have somebody who is choking or has like a partial obstruction is what we would call it. They have a little bit of food blocking their airway. They're usually coughing. They're trying to get it up on their own, but they're unable to. They could be starting to get tired. They're turning a little bit what we call cyanotic, or they're blue in the face, purple in the face, very red in the face. And then what we're going to do is we're going to ask them if we can help, ask them if they're choking. Go ahead, please. No, she's choking. It's the comedy shows here now. So she'll nod yes. And then we're gonna give these back slaps. And we call it a slap. It's more of we're trying to get that food out of there. So we're gonna use a firm hand and we're gonna
No, I don't want to.
Yeah.
Hard.
so
Hard.
here we go.
Hard.
Derek's gonna give me back slaps. Go ahead. Yeah.
Okay, so what's also really important is you want to make sure you're standing to the side of them and you have one arm placed right.
This one.
Yeah. One arm placed on their arm, right? And to the side. 5 back slaps in between their shoulder blades. Yeah, in between their shoulder blades.
Yeah. So that being said, we always ask, how hard are you supposed to hit somebody? First, we're not hitting anybody. We're providing life-saving back blows, right? And that's what we're trying to do, is to dislodge that food product from their airway. So not to hit people hard, but you have to use some force to eliminate that food from their air. So that being said, if that doesn't work and they begin to have what we would call maybe more of a larger obstruction, or they're unable to then move air, they're not coughing as much, they're starting to get more lethargic, then we're going to go into what would be the Heimlich maneuver, right? So does anybody remember the Heimlich maneuver? We all probably do, right? We all learned about it a long, long time ago. We find the landmarks. We're looking for the belly, right? Where their anatomical belly button, and that's what we're going for. And then we're going to go ahead and make a fist. So if everybody wants to make a fist, and then we're going to take our other hand, put it around the other hand, right? Just like so. She can give you the Heimlich whenever.
You want to make sure.
So yeah, you'll take your thumb, tuck it in, and then that's going to go right there in the belly button area. And essentially, we're trying to use our body in our hands, and we're going to put that person right up against us. We're going to be right up against them, because if you try to pull them when you have a gap between each other, then what's going to happen is you're going to pull them and they're just going to jerk back towards you. So you want them against your body. Use your leg to brace them in case they fall. And then you're going to squeeze into their abdomen to try to force air and push their lungs up. And that's going to force air to knock that food out.
It's not, yeah.
It's a little bit of both.
Yeah.
So it's
Below the ribs.
just below the ribs. So it's right where our little soft spot's going to be, right in our abdomen. And that's where you're going to apply that force. And that's going to be, and we're going to give 5 or as many as you can until that food comes out. And once that comes out, then they should find relief. You'll hear or you'll hear some wheezing, or you'll hear something where air is then moving. If that doesn't work, what might happen is they might become unconscious. Then we help them to the ground, and we then go into CPR at that point.
And that's what helped here.
And that's what helps you to arrive.
Oh, I forgot what I was going to say. Never mind.
That being said, if we alternate these back and forth, so let's say the person has a partial obstruction, they're trying to cough it out. They're trying to cough it out. We give the back blows. It's not working. Hey, I'm going to give you the Heimlich maneuver. Try to explain all this to them. I know it's a lot to take in. We do it in training all the time, so we're a little bit more well-versed with it. That being said, we'll give the 5 back blows, and then we'll go into the abdominal thrusts. And if that doesn't work and we're able to give them back blows again, and it seems like it's getting better, then that's a good sign. If not, what's going to happen is eventually they will become unconscious, and then they'll go to the floor. And you probably won't be able to hold them up. They're going to be too heavy. They're going to be very limp, and it's going to be one of those things you have to lower them down as best as you can and try to protect their head.
What you just said, because
Oh, I'm sorry.
I'm very sad.
So what's going to happen is they're going to end up becoming unconscious. And so they're going to lose consciousness, and their body's going to lose muscle tone, and they're going to end up falling to the ground. So that's why we want you behind them. And if you can see my leg, If you can get his leg a little bit wider, Derek, there you go. Your leg is going to go right against their buttocks, right? The big part of these big muscles. And that's what you're going to use in case they do fall. I can catch them with my body, right? So it's that whole, you want a nice wide base and then guide them to the floor. And that's the biggest thing. We don't want them to fall and hit their head. So we try to protect them the best we can to the ground, which is easier said than done.
I think also, I would just say though, be careful because the reason why we put our foot in between there is because we don't want to be knocked down ourselves. So be aware of how you are. We don't want you to get injured. You know, obviously your safety is what comes first. But that's why we do put one foot. It's like our little athletic stance, right? We're ready to go do something. Yes. Yeah. So the common things where people mess up is placement. They go a little too high, and they also with the fist, right? So you want to make sure that the thumb side is down, right? So sometimes I get this where they have the hand like this, but you want to turn it and it's this flat part here that is flush on the abdomen. And your other hand is just going to come around and grab that hand as best as possible. They say try to grab the wrist, the hand. You're going to try to do the best you can to get your arms around.
Question. Yes.
There's some discrepancy in the instructions. They call them back slaps, but the picture shows the heel of the hand hitting and the directions say firm blows between the shoulder blades with the heel of the hand. I would change the title in your next slide to back blows.
Sure.
We use them interchangeably.
Yeah.
Which is just.
They're used interchangeably. Yeah. With the heel of your hand.
So I think what you're seeing is, we use these kind of terms interchangeably just because we work in the medical field. And that's something where if I told any of us to give them back slaps or back blows, it would mean the same thing for us. So if it's more clear that we use the heel of our palm to do this than our fingertips, we're not going to generate the force with your fingertips. That's not what we're going to generate. So we want that nice hard part, the little thud to happen. We don't want a little bit of that thing. We want the loud thud to go happen. And we have a question in the back.
New question.
Sure.
Does it do any good if you're alone? Does it do any good to try to do that pressing or hitting on your abdomen yourself?
So there's numerous techniques. Whatever you can find to help alleviate that is what we're going to use. So if you have a countertop, a high chair, anything with a back on it. So you want to come to the middle, maybe everybody can kind of peek in. What we'll do is we'll use our body weight to thrust ourselves down on things. I think when we start to lose air, a lot of people go into a panic. And what's going to happen is you're going to be in fight or flight. And you're going to either fall on it on your own, or you're going to have the wherewithal for your body to do it for yourself. So for me, it's a little bit low. I'd probably use a countertop to go into me. Hopefully you're with somebody when this happens. If somebody's too large to get your arms around, what we'll do is we'll put somebody against a hard surface, like a wall, not a door that opens on its own. And then if you could see, she's just going to press on my abdomen. You can go either way. Two hands would probably be best. And you're going to push in and up, but you want them against the hard thing. So I'm pretty large. So getting your arms around me might be a little bit more difficult. So what that looks like without the wall behind me would be like this. And she'd be pushing in here, or you can push against someone's chest. And that'll help expel that air to push the food out. And that's the biggest one. Yes.
These things are advertised on TV as plunger type.
So yes, those are available. We don't endorse any. Oh, sorry. There's a plunger type of device where essentially it's a mask that goes over your face, and then you take like a little handle and you pull up, and it pulls. It creates a vacuum around your face, and it's supposed to pull the air out. Those work. They've been proven to actually be very functional and useful. The likelihood of having one of those in your back pocket while you're at the dining hall, maybe not as likely. if you want to have it at home, and just in case there is an emergency in your home, I have one because I have a baby. So just in case I'm not home, my wife can use it. We've trained on it before. They're useful. It's just another tool in the toolbox to use. This is what we use because this is usually, we're always going to have our hands and arms with us and our ability to hopefully do those things for those people. Any other questions? Do we want to do any type of practice? Finding landmarks on people?
Yeah, we're not actually going to do the Heimlich, but if you want to just figure out proper placement on your neighbor, that might be a good idea just so you can get the feel of it. Is anybody just like, I have no idea, I've never done this before at all? Are you pretty confident in this? The back slaps is a new thing too. The back blows, back slaps, yeah.
It's just so essentially it's encouraging people to keep coughing, right? You're going to coach them as best as you can. Okay, keep coughing, keep coughing, keep coughing. And if they aren't getting anywhere with it, you know, it's like a kid who has, you know, food stuck in their airway. You're just going to help to knock that out for them. And hopefully it dislodges it or moves it, and then they can get it out. And that's the biggest one.
Out of all the things that when we teach CPR, the Heimlich maneuver and the back slap thing is probably going to be the thing you use the most, just because of the way it is. So hopefully you guys all feel confident, right? And this, okay, let's move to 8.
Okay. All right. So the AED. AEDs have been around for a long time now. We put them in public areas. I think the first place to have them and has the lowest death from CPR is Seattle. They were the first state, or Washington was the first state to put them in these large cities and essentially started teaching kids in school how to use them. And they said, hey, these things are everywhere. Go ahead and use them. So early detection that someone needs help and needs one of these, or even just putting it on them, is crucial. It's an important thing. So like Selena was saying, if we aren't around because we're at training somewhere or we're on a different call and another fire engine has to come from somewhere else, that delayed response could be a little bit extended. So instead of it being 4 to 6 minutes, it could be 8 to 10 minutes. And that being able to grab that, put it on someone, and then it'll tell you whether or not they need to be shocked. So we have some crucial rhythms that we have. We have ventricular fibrillation, which means our heart is erratic and it's not doing what it needs to do. It's not beating effectively, right? So what this does is this will indicate, it'll tell us that if we need to give them a shock. So you find it, and we could probably pull it from the one out front too if we really wanted to, if there's, unless it's an alarm one. So this is a trainer. This will not shock us. So typically what we're going to do is we're going to turn it on. When you open them, a lot of times they'll turn on. Sometimes you have to press an on button. So we can take a look at your other one.
It'll say it 3 times.
Tear open package and remove pads.
And so we're going to follow the prompts. So we're going to tear open the package. We're going to remove the pads.
This is a trainer.
It's then going to tell you to remove the patient. We probably have another one. Let's see. Sorry? Yeah.
We're going to try this with battery flow.
Okay.
How about that one? There we go.
Tear open package and remove pads. Tear open package and remove pads. Peel one pad from plastic liner. Peel one pad from plastic liner.
It has to say everything 3 times.
Peel one pad from plastic liner. Place one pad on bare upper chest.
So there's a picture.
And these.
Pad on bare upper chest.
Let's see.
Place one pad on bare upper chest.
All of these pads are going to have pictures and they're going to tell you where they go.
Your second pad. Place on bare lower chest as shown. Do not touch patient. Analyzing rhythm.
So you don't know if you heard that one.
Do not touch patient. Analyzing rhythm. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
I'm gonna just lift up the mannequin so they can see.
So I can pass this around if you guys want to take a look. And that just gives us an idea of where we want to place those pads, right? So all the AEDs that we have on site here, they are going to show you exactly where they go. And commonly, these pads are going to be interchangeable for if one goes on this side or that side. So this pad can go down here and that pad can go up here. So there's no right pad to put in the right place. One goes on the upper chest and one goes on the lower chest on this side. And we're trying to send a shock through that heart. Question.
Is it on the skin? Or
On the skin. So thank you for bringing that up. So the biggest thing we have to remember is that we're going to expose people. And the way that we kind of explain it is that if someone's heart is stopped, then our modesty kind of goes out the window. And what we're going to do is we're going to save that person's life. And we really want to get these on the chest. So we're not going to not expose them, right? We're going to go ahead and remove that shirt or pull the shirt up or pull the shirt down, unzip it, unbutton it, whatever we have to do to gain access to it. We carry trauma shears and we're able to cut off clothes, which makes it really easy for us. Give me just 1 second. And what we'd like to do if someone is really sweaty or things like that, this usually comes with 2 sets of pads. We're going to try to dry them off the best that we can. And then we're going to stick them on them. These are really, really sticky. The ones that are in there, they're made to go on people that have probably just had a heart attack or have some type of diaphoresis. And what that means is they're just extremely sweaty. So it should be able to stick to most people. Question. Do you have a microphone right here?
Will you check for a DNR before using this? I wear one around my neck.
So like Selena was talking about, obviously we're looking for medical bracelets and medical pendants and things like that. As someone who is maybe not trained as first responders, as you guys aren't, I wouldn't expect everybody to immediately find those things. It's nice to say that we will do those in that time of emergency, but sometimes if we're anxious and our adrenaline's going, maybe we don't see it. It's better to put it on and someone to use it than to not. So I'm not going to tell you that all of you guys will. We will look for that. That's my job as a paramedic, is to investigate and find out if that's something that we're either continuing efforts or not. But for you guys in this room, I would hope that you do. If you don't, and unfortunately we can't, this isn't a you will and you have to kind of class, right? This is more of an awareness of, we want you to help each other if you can and when you can.
My other question is, we are old. Many of us have what's called fragile skin.
Correct.
Which is very sensitive to adhesive on the skin. So how do these pads react with fragile skin, or will they be removed with the alcohol swabs?
So that we understand exactly what you're saying, and we know that obviously as we advance in age that our skin is going to get thinner and it's going to be more fragile. We will do our best. What we are trying to avoid is to do any further harm than what's already happened. So we will do our best to do that. We're going to be as gentle as we can to remove those things. That being said, we may not use alcohol every time. It might be a life and death situation where we need to take over and go ahead and put on different AED pads so that we can shock the heart. If someone does have a DNR, we are not going to do those things, and we're not going to try to do that at all. So that being said, if someone doesn't have a DNR, we are going to put those on, and we're going to use all of our tools to save that person to the best of our ability. And then the hospital will hopefully remove those with a little bit more ease. Does that explain the question? Yeah.
If you guys want to try, if anybody wants to try it out, we do have trainers here. So feel free, if you feel confident enough, just be aware that it walks you through. So just follow the steps. Question right here?
Yeah.
what are the symptoms that would lead us to use one of those?
Yeah, so they'll be unconscious and not breathing. So they're not breathing. There are no signs of life at that point.
Yes, sir.
Yeah. Well, so you got up to the point where you got the stickers on, and I suppose you pushed the button again, but you didn't tell us what the machine's going to do next.
Very good. This trainer just went straight to, compressions. So what'll happen is saying analyzing heart rhythm, right? And that's when you do not touch the patient, because if you touch them, it could analyze wrong, right? So you want to make sure nobody is touching the patient. Then it will say something like shock advised, right? And at that point, it'll start flashing the button where you're going to push. Before you push that, please, you're clear, I'm clear, we're all clear. Make sure nobody's foot is touching him. That is the only point at which you can get injured, is if you push that shock button and somebody else is touching them. Once that button is pushed, it delivers the shock, and it'll tell you then to start CPR, with 30 compressions, and then it'll give you a beat like that. Or if it does not have a shockable rhythm, it will say shock not advised. Start CPR. So once again, just listen to what the machine tells you. Looks like they're taking off just in time. Go save some lives. So yeah, it just walks you through exactly what you need to know. Thanks, guys. I do want to hit on just letting you guys know that you are not alone here. So be aware that medical staff is trained in CPR and first aid, as well as the security staff. And I know one security guard here is actually an EMT, which is great that you have that. And I know that they are planning further training for them as well. So more advanced life care, stop the bleed, stuff like that. They're going to be, so you don't have to worry about, do we have to do CPR? Do we have to do this? We really don't want you to have to do CPR. It's a lot to do, but you can get help on the way and you can still help them. You can still make a difference. As well, to be aware about the emergency equipment, where the AEDs are. If you guys have first aid kits throughout here, know where they're at. Just, make a regular update walk where you can just identify where all the things are at, make sure your friends know too. It's just good to know where all the equipment is. And this is my last slide. So you don't have to do everything. You just have to do something. And the 3 things that we want you to remember, first of all, stay safe. We don't want you becoming a victim yourself. Assess, right? We want you to know we want you to be able to tell us what's going on. So assess the situation, assess the person, and call 911. Those 3 things can make a difference. Any questions before I just say thank you too? So here, let me hand you got it. Thank you.
As I see them, our little AEDs are the red things that were in the lower corner of your slide. They look smaller than the big box you had.
Yeah.
Do they still have what we need? And do they have pads that are as big as yours?
The size of the pad does not matter unless it's a pediatric pad versus adult, right? And the size of the AED doesn't matter either. They're all standardized, right? These are older trainer models. So the smaller ones are probably newer and sleeker, right? It's like our phones, how they get smaller and smaller and bigger, right? So you absolutely have AEDs around here that are going to do what they need to do. As long as they're being maintained and checked regularly, then yes, they are absolutely acceptable. These are very old trainers. We're in the process of actually getting new trainers. And those pads are one-time use. We have them and we stuck them back on there because, again, they're trainers, but they're one-time use pads. Well, they should be serviced by a company that will come through, and they are regularly checked by staff here. So Any other questions? Do we have another one? Oh, sorry, all the way over. Oh, thank you.
Thanks. There's going to be revision and renewal of the AEDs and the recheck and so forth, and that's on David Nelson's to-do list. So that's, but I would suggest that everybody know where it is that's closest to where you live.
Yes.
And you may see it every day or every other day, but it hasn't registered yet.
Yeah.
The presentation got sort of broken up.
Yeah, sorry about that.
So I just want to understand. You get the AED, you open the box, it gives you the instruction to put the pad on.
Yeah.
You put one pad here and one pad here. Then do you stand back and do nothing and wait till it tells you don't do the shock or do the shock?
That's a great question.
That's the part that got lost.
When you open up the AED, right, you may have to turn it on. It'll be a big button that says on, right? Or you open up the lid and it turns on automatically. They try to make them very simple. Once it opens up, you will take those pads and you will place one on the upper chest and one lower on the opposite side, right? Because you want that shock to go through the heart. And if they're on the same side, it's not going to go through the heart. So you want to make sure you bare upper chest, lower on the side. Once they're connected on there, it'll say analyzing heart rhythm, do not touch patient, or something very similar to that. Then that's when you step back, right? You make sure nobody is touching them. Then it'll tell you shock advised, right? And then it'll either make a sound or the light will start flashing, right? Saying it's ready to shock, but that's when you have to be careful. You're clear, I'm clear, we're all clear. Then you push that button. Make sure you're not reaching over the patient to push that AED shock button. You want to make sure the AED is on the same side as you, right? So I don't want to be reaching over like this because I could end up getting shocked. Once you shock that patient, it will say, start with compressions, or it will say start CPR, you start with compressions. It'll tell you something like that. And then in about 2 minutes, it'll reanalyze and it'll say analyzing heart rhythm, do not touch patient again. So it just tells you what to do straightforward. But if it reads a heart rhythm that it cannot shock, it'll say that. It says shock not advised, start CPR, start with compressions. Again, it's telling you exactly what to do. And also too, if you completely forget, call 911. They will walk you through it too as well. 911 is there for you. Great. Any other questions? Okay, looks like there's one over here.
You say it will tell us to do CPR after shocking.
Yeah.
How do you do CPR on a horizontal patient on the floor?
Yeah, the presentation that I gave today, we're trying to inhibit you all from performing CPR because we have trained medical staff here, right? So we're hoping that by that point you got that connected. There's already people there assisting with you because CPR is a whole nother thing. And even those firefighters that you saw over there, young and fit, and it is a lot of, it's very strenuous to perform CPR. So that's why I'm just telling you this part here. If you know how to do CPR and you want to do it, that's fine. But we're not encouraging that because you can do so much more. You can still help by doing all the other things to that point. Another question?
I know that Selena needs to go.
Oh, I'm fine. I still have a little bit of time.
I have one more point I'd like to make, which is for everybody who has still got a fully functioning voice, don't forget that the human voice is a marvelous tool.
Yeah.
Open your mouth and yell, help, call 911 as loud as you can. I once had to do it in the middle of the night, and the fire department got calls from neighbors a block and a half away.
That's amazing. No, that's so true. That is so true. Thank you. Yes, use your voice. I really appreciate everyone coming here today, and I look forward to seeing you all again towards the end of the year. We have another question over here. Let me.
How do we find out where all these AEDs are?
That's a good question. Where can they find out?
David Nelson has it on his agenda to do a whole.
David Nelson has it on his agenda to do a whole. Yeah. Yes. Great. Thank you. Thank you so much. And I apologize. I have to scoot right out of here.
Thank you.